In this recording, I'm going to go through a typical patient visit and cover many of the features that hopefully were shown to you in training or perhaps throughout your go live. I'll also highlight a few things necessary for meaningful use and other quality programs. The first thing that you will notice as you look at my screen is that I have the split screen set up. If you have a monitor that has a resolution large enough to support this, you can set up your documentation on the right and your review on the left. You can see that I've rearranged my table of contents here to put all of those at the bottom. You can actually have them anywhere in your list and still move them to the right-hand column. You can also rearrange the components here in any way that makes sense to your workflow. As I see the patient, I generally begin using several of my auto text and or typing in. If you build underscores into your auto text, you can hit the F3 key and it will take you automatically to that section. You can continue to F3 through the underscores to continue to fill in necessary information. These components will auto-save after a period of time, or you can save them individually. To complete the review of systems, again, you can either use an auto text. You can have your nurses complete this during the intake session, or if you want to do this yourself, there is a separate ad hoc form just for review of systems that you can complete. And you can fill in as much or as little information as necessary. One of the caveats to this is that you can actually select admits to and denies for the same review of system. So please be aware of that and try to avoid that mistake. One of the items that is automatically built in is when you create your note, either the office visit comprehensive, office visit simple, or any of the templates, any review of systems filled in either through the adult or pediatric intake forms or from the standalone review of systems will automatically pull into your final note. So in this case, I'm going to leave this component empty. I'm going to come back to my problems list and start to assess my problems. This is very easy by a simple click. If one of the problems has resolved, you can simply unclick chronic and it will move to resolved. You can add additional problems from this component as well. You do not have to complete your typing of the entire word, but the more details you type, the more refined your search will be and the more specific the diagnosis will be. If you want to add something as a this visit and a chronic at the same time, you can simply change this toggle and do so. If you create a this visit that is non-specific, you will see this exclamation point. You can further refine this by clicking on it and selecting the appropriate code. In some instances, the non-specific code may be the most appropriate. Once you address that, you can see that my exclamation point is gone. If you need to add any additional details to a chronic problem, you can do so by adding in comments. And once you save that, that will then pull into your note in addition to the problem list. I'm going to continue coming down my menu and review medications. Several providers have found that the easiest way to do this is through the medication reconciliation. And since you need to do this for meaningful use anyways, this offers an easy way to address any medications on the patient's chart. This is also probably the most efficient way to refill medications. If you need to change any of the details, you can do so through this component as well. You can add in reasons or instructions to the patient that will be communicated to the pharmacy. You can see that e-prescribing is the default for this medication. Any medication that is allowed to be e-prescribed, if there is a preferred pharmacy on the chart, it will default to that. If it is a narcotic medication, you can see that it either will not default or it will default to printing. If you need to change the dosage of a medication, you can do so from this component as well. So if I want to change this to 40 milligrams, I can either select one of the order sentences or I can simply select none. Using none will fill in the medication with the best logic, meaning how this medication is most normally prescribed. You can see it filled in one PO daily, even though I didn't select an order sentence. Again, I can make any changes. I can associate a diagnosis. I can also add new medications from this component. And again, the more details that I type, the more quickly I will get to the medication that I'm looking for. This may be more important for medications that have multiple different strengths or formulations. If the rest of the medications do not apply to you, you can simply acknowledge remaining home medications and then reconcile and sign. If there are medications to be printed, these will print automatically, as well as you will get the review box to review for electronic prescribing. In this case, I'm going to cancel because I don't want to actually send these to the pharmacy. If you accidentally added a medication that you don't really need, you can actually remove it from here as well. Now, once I complete my reconciliation, come back to my component, and I know that I've done it correctly because I get the green check mark. If you see a symbol that looks like a recycle sign, that means some of the medications were not addressed and you need to return back to medication reconciliation and review that. And then come to my histories component and review my social history, procedure history, as well as family history. If I need to make any changes to these, I can click on the heading of the component and make changes as necessary. I can do that for any of these. Obviously, this is a test patient that a lot of people have added to. In most of the cases, you would only have single entries. As I mentioned, any of the headings to the different components are links to that section of the chart as well. Health maintenance is another component that we want to make sure that we're utilizing appropriately. This will become very important to us as we move into some of our quality programs, including the merit-based incentive program that starts next year, which will replace meaningful use as well as PQRS, the physician quality program. In this case, you can see I have my health maintenance items grouped by category. You can simply have them listed. They will default to being listed by due date. There are several ways to satisfy many of these components. I won't go into each individual one of these. Many of those will satisfy based on ordering the appropriate test and or results returning back, such as my fasted lipid profile or creatinine. Those will satisfy automatically. Anticoagulation will as well. Immunizations will be satisfied when the immunization is documented by your nursing staff. Some of these do require orders, such as the depression screening, which requires placing one of the two depression screening negative or depression screening positive orders from your quick orders page. In the case of immunizations, you would not want to satisfy these from this component. You would actually want to go into the immunization component and add that as a historical medication. I will demonstrate that here in just a moment. If, for example, the patient had a diabetic foot exam done elsewhere, you could document that from here. You can also cancel permanently from this component. Many of these have several ways to satisfy the individual requirements, and those will be covered in some additional documents and teaching tools that we will distribute as we move into next year and focus more on our quality parameters. To determine which of these measures show up on health maintenance is controlled by the patient's age, gender, and chronic problem list. So if we go back up to the chronic problem list, you can see that several of these are showing up, such as the diabetic measures, because this patient has a chronic problem of diabetes. Some of these do get added because of medications on the patient's chart, such as the anticoagulation is added because the patient has a medication listed as Coumadin. You can individually add additional components as well by clicking on the plus mark and then looking for any of the components that may be of interest to you or your patient. You can also add a free text expectation as well. There are two tabs to health maintenance. One shows all items that are pending. The right tab shows all those that have been completed previously. Patient education is another component not to miss, as this is required for meaningful use. The key to patient education is first assessing your problems, which in this case means selecting the this visit or adding them as a this visit, and then coming back down to the patient education component. You may have to refresh this component individually for it to show the different problems. To get credit for meaningful use, you must select one of the suggested education components. Once you do this, you can then search for or select any other education component, whether it be a custom education or one of your favorites. However, you only get credit for meaningful use if you used one of the suggested education components. The next component I have on my list is the checkout component. This helps me recall whether I've completed all of the necessary steps. If I refresh this component, you can see that I've done medication reconciliation as well as patient education. I have not done my visit summary or created my note yet, and I have not done my charges. One of the caveats to this component is if you do create your visit note before selecting patient education, it will erroneously show that you have completed patient education. This is a known bug and hopefully will be fixed in future versions. Many of these headings also take you to that component of the chart as well if you're on this component and need to navigate quickly. Patient goals is my next component. I can quickly review any goals that nursing staff has gone over with the patient or that I've added previously. I can add a new goal from here, or I can assess or change one of the existing goals. I can add comments to it, or I can actually edit the goal itself. Save it, and then it updates in this component. From here, I have my documents component. Several different things that you can do with this component. You can change your display type. So we have several filters built out that you can select or deselect. You can also toggle by just my notes. In this case, you can see that I have not placed any on this patient. It defaults to looking at the last 50 notes, but you can change that to 18 months or 3 years. You can also start a note from this component as well. However, that may not be the most efficient way to do that. One of the items to pay close attention to under the labs component, although this should be set as default for everybody, but if you're not seeing labs that you believe should be there, please make sure that all laboratory data, the check mark next to all laboratory data is there. If you want to see outside labs, you can add that check mark as well. Diagnostics is my next component. Here is the immunization component. As I was saying earlier, if I want to document a historical immunization, such as perhaps a flu shot that the patient received previously, I will click on history. I have some favorites, or I can look at all of the vaccines, select the one that I want to document. I can choose just the year, or I can give it as much information as is known. I want to chart that. And now if I were to return back to the immunization component, it would show as given. And then if I also went back to health maintenance, that would show as well. That would update to showing that it's no longer a necessary component. As you can see, the immunization health maintenance requirement is gone now. Order profiles there if you want to review any orders that were previously placed or even placed during this visit. Visits gives you a quick snapshot into any visits that the patient has scheduled in the location, as well as any previous visits. Reminders is my next component. I can see any reminder that was added to the chart by any user. I will then place my orders, and I can do so quickly by simply selecting. You can see that I have several saved favorite components, such as my return to clinic component and another referral component. If you need to add problems that you forgot to add from the other page, you can do that here. Again, you have the option of changing to this visit in chronic, or chronic. And again, the more information I give it, the more refined my search will be, and the more specific diagnosis I will get. A couple of the orders to pay attention to ensure that you're getting full credit. If you do have a diabetic, the diabetic foot exam order should be used to signify that you've done the examination, and then be sure and document that in your note. Under the quality section are the two orders I was speaking to on the depression screen, either negative or positive. Depression screen is required on all patients 12 years of age and older at least once a year. This can be done by your nursing staff when they room the patient using the PHQ-2 that is located in the nursing intake form. We also have orders to satisfy the smoking cessation counseling, as well as dietary counseling for any patient that is obese. These again are regulatory requirements that will be covered in additional education. I can then open my diagnosis table, make any selections that I need to make. If a diagnosis applies to all of the orders, you can simply click on the heading of the diagnosis. If you need to be more specific, you can click in the individual boxes. I'm now going to sign these. And then I will return to my checkouts component, refresh, and I can see that that is now updated. Now I'm going to generate my note. You can see that, as I mentioned, it pulled in the comments next to the problem that I added earlier. It also pulled in my review of systems that I had completed through the ad hoc form. If you need to make adjustments to any of these, you can still do so from these components. If you want to remove any of the components, you can simply click on the X and that will remove it. If you make a mistake, you can use the undo button to add it back. Please note that any components that do not have data in them will not show in your final note when you sign it. So you do not need to remove them individually. If you're happy with your note, you can sign and submit it. If you need to save it because you are dictating or you want to come back later, you can do so as well. I'm going to sign my note. It returns me back to the summaries page, and again, if I refresh this component, I can see that my note has been finished. I'm now going to generate my visit summary. Depending on the amount of information that is being consolidated into the visit summary, this may take a few seconds or it may go quickly. In the visit summary, I can selectively remove any component that I feel is not necessary. By using the menu on the left, I can go to an individual component and remove those if I want to. One of the changes that will be coming out in the next couple of weeks will be the assessment and plan component, as well as the comments component. Instructions and comments component will be moved to the very first page. Again, here I can review, since I signed my note before I generated the visit summary, my assessment and plan actually came into my visit summary. However, if the note is not signed prior to generating the visit summary, this component will be blank. One of the recent changes is creation of an auto text, though, to bring that information in without having to copy and paste. One of the recent changes was to move away from the .ap and use a number sign. This is being done because the standard auto text list is getting very long and it may take a while to load. In this case, it didn't bring it in because it's already pulled in under the other component. Another item that you can bring in into this component, and you will want to do so especially for any Medicare wellness visits, is the health maintenance component. This satisfies the requirement to give the patient an individualized listing of their health maintenance items and any procedures, tests, or immunizations that may be due to them. Obviously, you want to make sure you address the health maintenance items within that component prior to doing so. I'm then going to save. Or actually, I'm going to sign, sorry. And then I would print this if it were appropriate. I can again then exit out of this component, refresh, and we can see that all of my necessary requirements have been taken care of. A few other things I want to highlight just really quickly within the main menu is the advanced growth chart section if you're dealing with a pediatric patient. There is also an appointments component that will show you additional detail over and above what is in the workflow summary page as far as future appointments and past appointments. We also have a very unique tool called Visual DX, which is built into Cerner now. And what this does is it passes information through to the Visual DX application. And so the application becomes contextually aware. You can actually click on any of these diagnoses or medications to quickly start searching by that condition or medication. And as you can see, the system has passed through the fact that this is a 40 to 49-year-old male with hypertension, and you can start to refine your search from there. Another item that may be of interest is the super bill. If you want to see what it's going to look like when your staff prints it out, you can view it here, or you could even print it manually yourself if you needed that. If you need to start a Power Note, you can go to the Power Notes document viewing section. We have two custom Power Notes that should be of interest to most primary care providers. That is the Well Child Visit as well as the Medicare Annual Well Visit. The Medicare Annual Well Visit has been designed so that if you complete all of the components, or if your nursing staff completes all of the components, it will satisfy any of the variations of the Medicare Wellness Visit. I believe that covers many of the items that you would encounter during a regular office visit. Please continue to be on the lookout for additional tips and tricks on how to better utilize the application.